Spokane. Dozens gathered outside Republican Representative Kathy Rogers' downtown office. And our Caroline Flynn working for you. She was at that rally earlier today. Caroline?
I don't know what I would do was the common phrase parents of developmentally disabled children used, protesting the proposed cuts to Medicaid they say means so much more than health care.
Don't have our care.
$800 billion.
Medicaid matters.
The amount of money the American Health Care Act proposes to cut from Medicaid.
Don't have our care.
10 million, the number of disabled Americans at risk of losing the services they depend on. Nearly 50,000 live in Washington. Some were present at today's rally.
We are lucky enough to have Medicaid.
Others were represented by their parents, like Stacy Clem, whose son Jackson was born with a rare brain malformation.
The biggest problem is he has seizures. He had about 10 to 15 seizures a day, and then we found his miracle drug. And so he went from 10 to 15 seizures a day to about 6 a year.
Medicaid pays for that medication, which costs thousands a year.
If we didn't have the Medicaid, we wouldn't be able to afford that seizure medicine. And before the seizure medicine came along, Jackson had fairly little quality of life.
But Medicaid does so much more than that. It provided the Clem family with a stroller to take their son who cannot walk outdoors.
For the last 9 years of his life, we have done Bloomsday, and we are able to go for hikes that have a trail where he could use his jogger.
I'm going to keep fighting for Zoe. And
for the Ladwigs, Medicaid personal care hours that see someone coming into their home and helping with the care of their daughter. An optional service that could go away if the proposed act is passed.
Medicaid allows her to live at home with me.
Both moms have worked hard to keep the disabled out of institutions and in their homes and the community.
If we do these cuts and these caps on Medicaid, those people are going to have to be taken out of their homes and put back in those institutions. And this isn't 1960 anymore. We don't put people in institutions just because we don't want to look at them anymore.
Again, reduced services and cuts to optional services are only proposed changes to Medicaid. The Arc of Spokane asked those in attendance to write their representatives to see that they do not become permanent. Live in downtown Spokane, Caroline Flynn, KXLY4 News.
Thank you, Caroline.